Hello, this is a short video to update staff on the key changes to the nursing documentation booklets in use at the Princess Alexandra Hospital. The assessment booklet and the care delivery document have been revised, with some assessments moving to Nerve Centre and new assessments added to the booklet. Key changes. The multifactorial falls risk assessment and oral hygiene assessment have been added to the must, Waterloo and discharge risk assessments on Nerve Centre. Other key changes to the document include a revised page order, updated care plans, addition of the catheter insertion decision tool, and addition of the delirium assessment tool. The registered practitioner is responsible for completion of the document. Registered nursing associates may be responsible for assessing and monitoring care plans, but the planning and documentation of care plans must be undertaken and signed by an RN. Pages with the red border need to be completed within 6 hours of admission. There are 8 care plans in this category. Care plans with the green border need to be done within 10 hours of admission. There are 7 care plans in this category. An example of a completed care plan is on page 6 for your reference. Patient demographic details. Page 1 and page 2 have swapped, with the front page now showing the patient demographic details. Page 2 now shows the index and signature page. The demographic details must be completed within 6 hours of admission. It is vital that the patient's next of kin contact details are captured here on admission. The escalation plan is now at the start of the document and should be updated as circumstances change throughout admission. Infection control assessment. The infection prevention and control assessment has been updated and includes COVID-19. As part of the admission, the patient should be screened for certain infections as part of the trust protocol. At the bottom of the page is the care plan, which can be started and completed as necessary. Safeguarding adults and young people. The next 4 sections contain patient-specific questions to assess risk related to safeguarding, cognitive impairment, medication, and end-of-life care. This assessment must be undertaken for all patients. If the answer is yes to any questions, then the appropriate action must be taken and documented on the patient records. Enhanced care risk assessment and care plan. This assessment is to be completed within 6 hours of admission and thereafter 12 hourly. Scores are taken from their level of cognition, risk of falls, risk of absconding, and clinical condition. These scores are added to give a recommended level of observation for the patient. Pressure ulcer prevention bundle. On admission to the Princess Alexandra Hospital Trust, all patients should have an appropriate pressure ulcer risk assessment completed within 6 hours of admission. This is completed on Nerve Centre by a registered nurse or registered nursing associate. Based on the Waterloo score, there are recommended interventions that you may implement. You can pick actions from higher risk care plans or document a specific individual need at the bottom of the page. Patient handling assessment and bed rails risk assessment. The patient handling and bed rails risk assessments have not changed in format. These must be completed for all patients on admission or upon transfer to the clinical area. It must be updated on a weekly basis or when a clinical condition changes. Multifactorial falls risk assessment. The multifactorial falls risk assessment tool has been moved to Nerve Centre. However, the accompanying care plan remains in the booklet. They must be completed for all patients, regardless of age, and must be done within 6 hours of admission. Reassessment is completed on Nerve Centre weekly, unless there is cause to review it sooner, such as in the event of a fall. If the patient answers no to all questions, the patient falls under the low risk care plan. If 1 or 2 medium risk factors are present, the medium risk care plan is used. If there are 3 or more medium risk factor questions or any high risk factor, the patient is automatically given a high risk care plan. Pain assessment. The pain assessment has been shortened and the Socrates assessment tool added. If the patient has acute pain needs, please speak to the pain specialist nurses and sign the appropriate interventions on the care plan. Oral hygiene screening, assessment and care plan. The oral hygiene screening tool has moved to Nerve Centre and the assessment is to be completed on the iPad within 6 hours of admission. The care plan and care delivery documentation remains on paper. Inpatient care. The next care plan documents the common interventions undertaken for a patient admitted to the hospital and sets expectations regarding their admission and discharge. Communication. The communication assessment has been shortened and includes recommendations on how to support the patient while in hospital. The patient must be asked what their baseline communication needs are and whether they have changed since coming into the hospital. Delirium risk assessment and care plan. This assessment is required to be completed for patients over 65 or with a pre-existing cognitive impairment or dementia, or a serious illness, or have a sensory impairment, or have had any previous episode of delirium. Additional resources may be found in the Dementia and Delirium folder on the X drive. The following sections need to be completed within 10 hours of admission. Respiratory assessment. An acute and chronic respiratory assessment remains in the booklet. If a patient answers no to all questions, the form must be signed that no care plan is required. Patients presenting with exacerbation of COPD, asthma, and using home oxygen should be referred to the respiratory nurses. Nutrition and hydration assessment. All new patients admitted to the hospital need to have a nutrition and hydration assessment done within 10 hours. Must assessment is still undertaken on Nerve Centre and completed within 6 hours or whenever the patient's condition changes. Diabetes. The diabetes assessment is used to assess the diabetic patient's usual regime and their ability to manage this independently. If indicated, the care plan may then be completed. Elimination. Assessing the patient's typical bladder and bowel function remains important. Any areas of altered function can be addressed in this section and care planned accordingly. Staff are now able to record bowel function using the Bristol stool chart on Nerve Centre. Indwelling urinary catheter insertion tool. The decision tool for inserting a urinary catheter has been added, aiding in the decision-making process and providing space to document the procedure. Personal cleansing and dressing. In this section, the nurse can record the patient's usual level of function and the degree of assistance needed. The care plan has space for individualised strategies to meet the patient's needs. Lifestyle. Here, aspects of the patient's social history are recorded. Any social issues can be identified and appropriate discharge planning initiated. There are no core care plans, as this care plan needs to reflect the individual patient's needs. A discharge risk assessment can be undertaken on Nerve Centre and a score added. Additional care plans. These can be used if more care planning is required. For instance, one could extend existing care plans, rewrite discarded care plans, and write original care plans for issues not covered in the main assessment. Care delivery document. I will now discuss the correct completion of the care delivery document. The care delivery document contains the following: patient body map, invasive devices documentation and body map for peripheral lines, daily catheter care plan and child without catheter care plan, Eskin bundle documentation chart, food and drink charts, oral hygiene documentation. The registered nurse is responsible for completion of this document. Record keeping can be delegated to healthcare support workers, assistant practitioners and nursing students, but the accountability remains with the registered practitioner. Body map. On the first page is a body map to record all wound types noted on the patient's body. A list of codes for different wounds can be found on the right-hand side of the page, together with guidelines on completion. A red box has been added for staff to record if a patient's pressure areas were intact on admission. Page 3 has changed, with separate areas for documenting skin integrity on admission and to carry over records of existing wounds from other books. Invasive devices documentation and peripheral line body map. The peripheral line body map and invasive devices documentation remains unchanged. Daily indwelling urinary catheter care plan. The catheter care plan has been moved to the care delivery document and includes prompts for catheter care and signs and symptoms which may suggest catheter-acquired urinary tract infection. Trial without catheter decision tool. An assessment tool for considering removing the patient's urinary catheter has been added to assist staff in making this decision. Eskin bundle documentation chart. The Eskin bundle documentation chart is an updated form of the current chart. The validation section at the bottom of the paperwork has been removed. A booklet normally contains enough space for 7 days of documentation. Food and drink charts. Food and drink charts have been added to record a 72-hour snapshot of the patient's intake, along with advice on referring to the dietitian. Oral hygiene documentation chart. Oral hygiene remains a priority in the hospital. This section allows staff to document episodes of oral care being given. We have specified what equipment to use, given step-by-step guides, and given a picture image of what you are looking for inside someone's mouth. We have revised and consolidated the oral bundle chart to just one page, which will last for a 7-day period. Staff are required to document all episodes of oral care delivered to patients daily, and we have also included denture care. Pages are edged in pink to increase their visibility. Enhanced care assessment and care plan. This has been repeated to enable staff to update the enhanced care risk assessment. ABC behavioural observation chart and enhanced supervision record. These have been added to enable staff to document patient behaviour and activity, and to help identify trends and times when patients may require additional support. It provides cues such as recognising triggers for the behaviour and recording staff reactions and the patient's response. Conclusion. That concludes this presentation on the updated nursing documentation. For any queries or feedback, the practice development team is always happy to help. Our team can be reached on extension 8232 and by email on paht.pdt@nhs.net. Thank you for watching.